Chief Clinical Officer Dr. Amy Williams is here to answer your most frequently asked questions. First of all, what is the Headstrong Project?
The Headstrong Project is a really special place to me. And the reason why I feel like I'm so lucky to be the chief clinical officer at an organization like this is because we're different. We offer barrier free, stigma free care. It's easy for people to find us and get in. We get them in quickly and with clinicians who understand them, who we have vetted, who we make sure are like the real deal and know how to treat trauma in a way that is effective and gold standard. And not only do we do all that, but we do it with no cost for the first 30 sessions, and we don't cut off treatment at that point. Somebody can continue care with us as long as they need to.
What makes the Headstrong Project unique?
One of the things I think that makes us very unique is that we are hyper focused on doing trauma focused care that is high quality, evidence based, and we don't have any session caps. There's nothing that says like a person can only come to us for so many sessions. In fact, the first 30 sessions of care are completely no cost to the veteran. And we're able to provide that then ongoing if they need more care with just a small copay. So the first piece is that access piece that we're there. There's not a barrier in terms of cost. The second piece is our expertise. So we have a little over 300 clinicians at this point in time. And each one of those clinicians are vetted for two things. Number one, that they have military cultural competence. In fact, they meet with a veteran to just do a vibe check. Basically, like, can I imagine myself being in therapy with this person? And the second piece that we look for is that they have training in one of the three evidence-based therapies that we do. They're the gold standard for treating PTSD. And I can talk more about those later. Those are the two things that make up our clinical partner network. Then when somebody comes to us, we do what I call concierge like matching between the therapist and the client. So it's important that we get to know what the client's looking for in terms of scheduling, telehealth, cultural considerations, et cetera. And then we look at everything that they want and that we think they need, and then we match them with a therapist who has those attributes. So we have a 97% return rate from people that come once, they come back. And then I think the last thing that I want to point out is that we can provide consistent treatment. We will not refer somebody to a therapist if they can't see them weekly and give them consistent, constant treatment until that person is done needing therapy, which is very different than what you tend to see in other places where maybe they can get somebody in. It might take a long time, but they can get them in, but they can't get them in consistently. And I did forget to mention that our time to care right now is sitting at a median average of 11 days from the time of intake to getting in the seat with a therapist. And the goal for big systems like the VA is less than 30 days. So us doing 11 days, I think, is a big differentiator in terms of who we are. And we're not connected to the VA in any way. Like, if people don't want to share their records, we are off the radar. We don't use insurance. So there's no worry for people about, oh, I might lose my security clearance, or this is going to impact my career negatively if they come get care with us.
How prevalent is PTSD in the military community?
Well, it's hard to know exact rates because sometimes people underreport, et cetera. But the surveys that we do have that we know is especially for post 9/11 veterans who've deployed to combat zones, we know that those numbers can range up to 30%. So more conservative estimates of all veterans in general, about 20 to 30% is what we're looking at. And some of those people came into the military with trauma, and then their service either exacerbated that or they had additional trauma during their service. And that's why those rates are so high. We know that combat exposure in particular is a very high risk, as well as any kind of sexual violence, which unfortunately does happen in our military and has happened to people before their injury as well.
Who is eligible to receive care through the Headstrong Project?
Right now, we will serve veterans regardless of discharge status, regardless of how many years they served. And we want to make sure that anybody that served in our armed forces is able to get care. So eligibility doesn't matter in terms of era of service, et cetera. We also serve segments of the active duty population, and we will serve family members as well if what they're needing is in relationship to the Headstrong client's issues. So, for example, a spouse who's coming into therapy because of their partner's PTSD.
How does someone get care with the Headstrong Project?
It's really easy to get into care with us. That's part of being low barrier. We didn't want it to be hard. So we have a connect to care form on our website, and people have to put in really minimal information. Just basically, are you a veteran? What state do you live in? Your name, your address, and then a little blurb about kind of what are you looking for. From that point, one of our care coordinators will reach out to them via email and text within usually the same business day, but within 48 hours for sure, but it's usually the same day. Once that happens, we offer them a time to meet for about a 30-minute intake where they meet with one of our care coordinators, and we start to find out like what they need, what they're looking for, so that we can do the matching that I think makes us really special. At that point, we refer them to a therapist. We make sure that therapist has room, and then they are off in terms of that treatment. They are off and running, I should say, with that therapist, and they become really a one-on-one with that therapist. And then Headstrong really moves into the background for that client. Yes, they're still a Headstrong client, but their primary interaction is with their therapist. And that will continue up until the time of discharge. The only time we're usually reaching out to our clients is we do surveys with our clients to make sure that they're satisfied after intake, midway into treatment, and then when they discharge.
How do you ensure veterans receive treatment that meets their needs?
One of the things that we look for when we're looking for therapists is we look at all the different specialties they have. So we look at, does somebody have substance use experience? Do they know about traumatic brain injury or TBI? Do they understand military sexual trauma? So we look for different specialties within our clinical partner network so that we know that when we do that intake with people and we find out like what are the ins and outs of what you're going through, that we give them somebody that's going to be able to respond to that. Another area that I haven't really talked about is if somebody's at high risk for suicide, because there's a suicide epidemic in our veterans, as most people are aware of. And so our clinicians have undergone special training to do treatment specific to suicide. So we're looking for that, we're asking these questions, and then we're pairing them and matching them with a clinician that we think they'll do well with. And if for some reason that doesn't work out and the person says, hey, this person isn't for me, they know that they can come back to us and we'll find them a different therapist.
Who are Headstrong clinicians and how are they vetted?
So our Headstrong clinicians right now, we have psychologists, social workers, licensed marriage and family therapists, psychiatrists, counselors, all over in the states that we serve in person and then provide telehealth. And so they're all licensed. We don't use any trainees, which in a lot of cases, like people in the bigger systems are sometimes using trainees or in other nonprofits where they're trying to cut corners. So they're in private practice. They are 1099 employees, if that kind of structure helps to make sense of it. So we're paying for the services that they're offering, but they all have their own practices, they're experienced, and we vet them for military cultural competence to make sure that they understand the military culture because veterans are different.
How do Headstrong clinicians treat post-traumatic stress?
So at Headstrong, we believe really strongly in using the top evidence-based treatments for PTSD. And there are three that are considered gold standard: cognitive processing therapy, eye movement desensitization and reprocessing therapy, or EMDR, and prolonged exposure therapy. Those are the three primary treatments. All of our clinicians are trained in at least one of them, and many of them are trained in two or three, so we can give veterans more options. If somebody comes to us and they say, I know I want to do cognitive processing therapy, we'll put them with a therapist that does that. Otherwise, we put them with one of the therapists that we think will match them overall. And then the veteran and the therapist enter into a conversation about, here are the options, that you have for what treatment can look like. And that is a joint decision made between the therapist and their client. And then they then go forward. Now, there may also be some other therapies that they bring into that. Those aren't the only things we do, but that's the baseline, and that's what we expect everybody to have access to.
How does Headstrong measure client success?
We measure client success in a couple of different ways. So when we think about success at Headstrong, we're actually measuring metrics that don't have anything to do with clients, like how long did it take for us to get them into care? how many people were able to get a certain number of sessions in a certain time so that we know people are getting regular access to treatment. And then when it comes to clients, what we do is we use industry standard measures that are self-report about how's your depression, how's your PTSD, and we give these measures at baseline and then throughout therapy. And then the last thing that we do is we give clients surveys at the beginning, about 6 sessions in, and at the end at discharge, to ask them what their experience was like, how has this impacted their life.
What improvements do clients experience after receiving treatment?
In terms of like the clinical measures, what we know is that we meet or exceed what is typically seen in other settings. And so a large percentage of our folks are reporting, yes, my PTSD symptoms are down. Yes, my depression is better. But I think one of the most impressive metrics that we have is when we survey people, 89% of veterans or clients that are in care with us say that their lives were improved by the treatment they got at Headstrong. I think it's really important for people who are suffering from PTSD and the impact of trauma to know that there's hope, that treatment works, and that you can get better. This is not a forever life sentence. We can't necessarily erase the hard things that you've done and that you've been through, but we can make you able to engage and live your life again and be able to be who you want to be. Triumph over trauma.
Where are services available?
Right now, at the time of this recording, we are in 18 states plus DC. However, we are expanding by approximately 2 to 3 states every year where we provide in-person services as well as telehealth. But what's really special about what we've created through either dual licensures where clinicians can be licensed in more than one state or through some interstate compacts, and it's called SIPACT, we're able to actually follow a veteran or active duty service member. If they start with us in one state and move to another, we'll get them a clinician that can see them in both places, and we can cover all 50 states via telehealth right now.
When one veteran is healed, what does the ripple effect look like?
You know, it's not just the veteran that's suffering. When somebody has been impacted by trauma, it impacts everything from their employment to their children, their spouses, their friends. And so when you start to heal somebody and they are no longer isolated, they're not feeling irritable and angry all the time, they're able to go and engage with their life again, they're able to coach their kids' soccer team. That makes a huge difference in terms of the ripple effect it has, not only for them, but in their family, in their communities. They're free to lead, to go into leadership positions or to advocate for each other. And you'll start to just see them open up, because the people that serve in our military signed up because they believe in service. And when somebody is really buttoned down by trauma, it impacts not only them, but it impacts that mission mindset that they had when they entered our military. And so we're giving that back to them and creating that ripple effect in the community.
Does Headstrong plan to continue growing its services?
Our goal is to be able to serve any veteran anywhere. And so that would include in the United States. And we really want to be eventually able to serve, doesn't matter if you're in Alaska, Hawaii, Massachusetts, that we would be able to serve you. And so in order to reach that goal right now, we're growing by 2 to 3 states every year to where we can provide in-person care, and eventually hoping to get to a place where we can do that everywhere.
How can people support the Headstrong Project?
Well, high quality care costs money. And so one of the things that is really important to us are our funders, our donors, and the support that they give us that allows us to do this really important work. So now more than ever, given all the pressures in our country, cuts to federal spending, people's awareness of what we do, we have seen a demand for our services grow 15% more at the same time as last year. And that number is only increasing. And so it's really important that if there's a part of you that thought, okay, yeah, I want to do something, I want to get involved, this is the time. We need that support in order to provide those services to the people that are reaching out to us, so that we don't have to turn anybody away, because that's not something we ever want to have to do. The second way that people can support is by raising awareness, by following us on social media, engaging with us, sharing about our story with people that might want to know about us or need our services. We need you. We need support from people that believe in what we're doing. And I just can't underscore that enough. Without all of you, then we can't do what we do.
To learn more, visit us at theheadstrongproject.org.